day, after visiting several of the groups, I did not feel that LGBTQI2S gender non-conforming people had a voice or representation or a presence in any of these groups, or at least I could not see that. And I was sure that I was not the only one on this spectrum, right? As many people as there were. So in June of 2012, a brilliant young woman named B.T. Craig and we got together and we wrote a proposal to the Alameda County Pool of Consumer Champions Steering Committee, voicing our concerns about the lack of visibility. And this was in June, and undoubtedly they listened, because in January of 2013, SAGA, the Sexuality and Gender Alliance Committee, was formed. And so we've celebrated our 7th year anniversary in January. So yeah, that's a good thing. We're all happy about that. Okay, so if you would be so kind, we already have your names, but in the chat box, put your names, perhaps where you're from around the United States or beyond. And know that this presentation, I have 5 brief slides, and I would really like to then open it up to dialogue between yourselves. I also would like you to know that everything that's going to be in the chat box, and hopefully there will be a lot, questions, comments, and concerns or answers, will be kept, and I will receive all of that script, all of those scripted articles in the chat box, and I will at some point in the near future put all of that into a document and make all of this available to everyone who is now in the room. Okay, so I'm hoping that that will work for people. I'm hoping to have more in the chat box and we have time to discuss and have more hands raised about questions or responses than we have time to even answer. So with that, I think now I'm going to share my screen. Is that correct, Katie? Or Katie, have you anything that you would like to say before we begin?
Thank you so much, Kozi. Yes, that is all correct. This workshop is being recorded. So if you have an issue with that, you can change your name or turn your video off. But we just wanted to make sure that you were aware of that. The breakout sessions were not recorded. We also ask that all participants please honor the conference comfort agreements found on page 6 of your conference program. Also, if at any time you need peer support, that is available. You can go to our website at peerapocalypse.com for a list of on-call peer support specialists. And yeah, that's all I had. I'll turn it back to you, Kozi.
Okay, and Katie, I will not be able to see anything in the chat box or anything like that. If someone wants to, you'll let me know, I'm sure. Thank you. And so, okay, with that, let's see if we can make this Zoom thing work. How many people are all zoomed out? Raise your hands. Yes, I get it. Okay, let's see here. All right, can we all see that? What does this say? This is in my way, whatever that is. Okay, let's see. Okay, there is a dialog box blocking my view. It says Destiny Patterson has entered the waiting room. How do I get rid of this, Katie? So I could do, should I just admit her, I guess?
Oh, don't worry about that.
Yeah, just admit her.
Okay, well, yeah, I had to do that to get it so I could read the screen. Okay, very good. All right, here we are. The LGBTQ QI2S gender non-conforming mental health care crisis. This is a solutions-focused community forum. I am, once again, Kenneth Kozi Arrington, your facilitator for this meeting today. Okay, now this is not working. Okay. So now that we're in this, my clicker isn't working, nor am I able to advance to the next slide. You know what that's about? was working yesterday and this morning.
What mode are you in? You're in PowerPoint?
This is a PowerPoint presentation, yes.
Okay. Are you in the presenting mode?
It says I'm sharing my screen. I didn't see anything that said present, which was what I was for.
Yeah, no, so the screen is being shared.
Right. I just can't advance my slides now.
Right, that's a PowerPoint thing. So if
Can you
could
advance with a mouse click?
Let's try it. Nope. Oh, wait a minute. Okay. There we go.
There we go.
All right. We're going to get this done.
Back in business.
All right. So, and see, this is blocking. These boxes are blocking. How do I get rid of it? I think, there we go. It still says that. Okay. Due to stigma and discrimination, LGBT communities, there's a text box blocking my, it says talking, Kenneth Arrington. How do I get rid of that? Or am I able to?
I think you should be able to click and drag.
Okay, all right, good. Woo, here we go, let's try. Due to stigma and discrimination, LGBTQ plus communities are disproportionately affected by mental health challenges, but the mental health system struggles to address our needs. Okay, older LGBT adults face an escalating crisis of care as traditional modalities are ill-equipped to support them. There are LGBT seniors, of which I am one. All right. Transgender suicide rates are as much as 9 times higher than the general population. That's pretty sad and devastating statistic. And I'm really kind of wondering and thinking if in the midst of this pandemic that these numbers are even greater as people are being isolated and sheltered, probably with people who don't understand them. Who knows what the situations are, you know? So it says, here's our transgender suicide rate, 5% versus 40%, devastating. LGBT youth face homelessness and trauma in alarming numbers. And once again, because of the pandemic, this is really out of control. A lot of teens are taking their lives, from what I've heard, and being turned out and becoming more homeless. There's even more homeless youth than ever in need of mental health services and just kind and gentle, loving care, wouldn't you think? Absolutely. Here we come to the undocumented LGBTQ families and community members who face discrimination, separation, and deportation. And that's unfortunate, and we know who the main culprit behind this is. There they are, undocumented. And as a result of this, all of our civil rights for LGBTQ plus people in the United States are actually moving backwards and not forwards. It's a terrible thing to have to say, and it's even worse that it's true, right? Okay, so the question now becomes, what do we do about it? What do we do about it? There are no easy answers, and this session does not propose any quick solutions. Instead, our aim is to engage and amplify the voices of those most directly affected by the community crisis of inadequate LGBTQI2S gender non-conforming mental health care. And those voices belong to you. So I have 4 talking points, and I'm going to bring them up one at a time and hopefully have some dialogue and discussion in between each one. And once again, I encourage you to use the chat box if you have a whole lot to say, or if you're unable to be one of the ones chosen to speak directly. We really appreciate it. All right, so here we go. Our questions to you. Question number 1. What unique mental health needs do you have as an LGBTQI2S gender non-conforming community member that the current system is unable to address? I am going to be silent while people either raise their hands or type in the chat box, and I'll rely on Katie to let me know what's next. Yes, we all have unique mental health needs. Anybody?
Chris in the chat box said, I'm trans and in a rural community, so we have limited health services and no specialized endocrinology.
Endocrinology, very good. Thank you, Chris. And where's Chris located? Where are you?
Located in Arizona, the middle, in between, halfway between Phoenix and Flagstaff. So it's considered in Yavapai County. We're pretty rural, predominantly white, conservative. Our median age is 57, with the 1/3 of our population over the age of 65. So we really, really lack in LGBT resources, support, transgender specialized care. And that's actually one of my roles, is to help develop the kind of provisions for a council over Northern Arizona to address the needs. I've been doing this work for several years, and it's quite challenging at times.
It sounds like it might be challenging. And for whom do you work?
I work for an organization called Care First, which is under Centene Corporation. So we basically are the insurers. I work for the state, basically. The insurers of all of Northern Arizona is what I cover.
Great. Okay, and since we do have your voice now, would you like to say more about address this question any further? Being rural, I can understand that. And how are you accepted in your community? How
are you asking me?
Yes, you, Chris.
Oh.
What's it like for you where you live? How are you accepted?
Here, let me see it so you can see my face. I might be a little splotchy because I have limited service. So as you can see, I do not look the part. I was born biologically female, and I've lived as a man for 12 years now. So people don't know in my local community. I keep myself pretty, not in the closet, but kind of live a self-life, which makes it difficult. Because if you look up my formal name, I'm pretty well known as an advocate. I've been published, I've done a range of things in advocacy. I'm also the first transgender person to ever get custody of my child in the state of Arizona. So here it is, I have this life that's really big over here that's LGBT, but I find it very difficult to do anything related to LGBT in my community because I have to live kind of a stealth life for my own safety. So not very many people know about me in my local community. So I feel safe because no one knows.
Okay, well, great. Thank you for sharing that, and congratulations on being the first person to get custody of your kids. That's a landmark in and of itself. Thank you so much. Who else do we have, Katie, that would like to respond to this?
Yeah, absolutely. Looks like Sage said that they're trans and non-binary and also pregnant, which is presenting a lot of mental health and gender-related struggles that they're not able to find support for.
Okay, I'm wondering, would she like to let us hear her voice? Their voice.
Sage, would you like to share anything?
Sure. Yeah, I'll come on to screen, but yeah, it's just a very, I knew that pregnancy would be a very gendered experience, and it's just even more so than I ever could have imagined. And even I'm finding a lot of therapists and counselors and even like medical support, even while they're trained on working with LGBTQ plus communities, it seems like pregnancy is kind of its own thing, and so I just haven't been able to find anyone who can really like provide that kind of mental support.
Imagine that is not a very good feeling, and it may cause a lot of undue stress, especially for someone with child. Would you say that's adequate or true?
Yeah, definitely.
So one thing I did say, I do not want to misgender anyone. So Sage, what pronouns do you use? If that's
I use
okay.
they, them pronouns.
They, them. Okay, well then I want to apologize for my statement. I said perhaps she. And so if I do that, everybody, you can just feel free to pull my coattail. And thank you for sharing that. That's an interesting predicament and situation. Would anyone like to respond to Sage about what she has just shared? Anyone else had similar experiences of being with child and being trans or any of these kinds of things? Let's talk a little bit about it.
I have a question.
Okay.
Hey there. I'm Liv.
Liz.
I'm wondering, as a queer person, you know, oops, sorry. As a queer person, did you find any resources at all, or because yeah, I definitely want to go down that road at some point soon. So I'm wondering if you did find any resources.
Right now, the resources I have are my doctor specifically works with the transgender community and does a lot of hormone replacement therapy. And so she is very awesome and aware, and she's located in Oregon City. And she's referred me to a therapist who I think is in Milwaukee, but who is a trans man, but I have reached out and haven't heard back yet. And I've reached out to a few other counselors, and also I'm trying currently to find a trans doula or potentially a midwife. And I found one person in Portland, but they don't necessarily come to the more rural area. So yeah, that's kind of what I've found in my area, at least.
Okay.
Thank you.
Thank you. I was just wondering.
Yes, and thank you, Liz, for the question. And Liz, you're in Oregon as well?
Me? No. I'm in Rhode Island. I was wondering, you know, if there were any online services, basically.
Okay. And Liz, one more question for you. What pronouns do you prefer?
My name is Liv, L-I-V, and my pronouns are they, them.
Okay, L-I-V. They, them. Great. Thank
you.
you. Of course, you're welcome. All right. Any other questions in our chat box or anyone who would like to speak?
Let's see.
And our overarching question right now is, what unique mental health needs do you have as an LGBT community member that the current system is unable to address?
I just wanted to capture Gina's comment earlier. Gina said that we, as trans people, are not even recognized in Kansas.
Oh, in Kansas.
Mm-hmm.
I wanted to share, in one of my last jobs and positions or roles, whatever you want to call it, I created an LGBT program at a mental health facility that also had a hospital and a crisis stabilization unit. And I worked there for about 3 or 4 years in total. And I did a lot of research and studies related to the collecting of data and information on this topic. And what I found, especially in rural communities, especially around Arizona, I'm not sure what it looks like anywhere else, but I can speak for here, that the majority of transgender folks get diagnosed with bipolar disorder, multiple personality or DID, dissociative identity disorder, also subsets of schizophrenia with sexual perversion as basically a subcategory. So before they even get diagnosed as transgender, I would run up against that hurdle of therapists and longtime psychiatrists that said, hey, wait a minute, we've been seeing this client for, 10 years and they've never told me that they were transgender. Or, I don't necessarily believe that because they have all these other problems. So it must be that they're just playing with you or they're not sure. So a lot of times it was disregarded as other things before transgender identity was even identified. So that's one struggle I found with transgender folks. And then when it came to gay men and lesbian women, I found even greater challenges when it came to, well, we don't necessarily, their identity doesn't matter. We can just provide them care and inclusive care, and it shouldn't matter whether they're gay or lesbian. But I would argue that one of the number one reasons why people seek out mental health services is because they're victims of a broken heart. Usually something about their relationship or their relationships in their lives are the reasons why they're seeking out support and help. And these kind of issues are being dismissed because I find that most or many mental health professionals steer clear of the conversation about sexuality and relationships because it's uncomfortable. And I think that we do a really big disservice to the LGBT community because if we spotlight it, well, then we must be biased. And if we don't talk about it, then we're ignoring it. And that creates a heck of a challenge.
It's quite a lot, and I agree with all of that. Because of a professional's discomfort, I am left to suffer. Yeah, that's pretty daunting. Thank you, Chris, and Gina, and Liz.
It's funny because we have a fairly large community, but we are underground almost. It's really strange that we have we're a college community, so there we are accepted, but then it's very Voga German and very Christian Catholic. And they don't even acknowledge that we have homeless people or that we have Black people but we have Chinese people because that's part of the college. But sometimes it's really strange how they how you just don't identify. I mean, I haven't for years. When I lived in Ohio, I was out and I knew, but here, I have to go to one of the bigger cities, and right now I'm just not traveling to get there.
Yeah. It's a lot. Okay, well, thank you. I saw someone had raised their hand. Who was that?
Looks like Sean.
Okay,
Sean Mahoney.
Hey guys, hey Kenneth, thanks so much for this. I think the thing that I find professionally, I work for MHAAO here in Portland, Oregon as a program manager, but before that, I was doing peer support at OHSU Hospital. And I think the biggest thing that I have found, and the people that I currently supervise have found, is the lack of treatment for substance use disorders for LGBTQ plus individuals. Our folks are 5 times more likely to develop substance use disorders. So the fact that Portland's a big gay old town and we only have one queer sober living with limited beds. We have no trans sober living, which is ridiculous given the substance use disorders found in that community. So it's like, although we are at a high risk and well-known high risk community that gets higher risk every year, despite advancements made in civil rights for LGBTQ plus people, our relationship with substances keeps getting ignored. And I feel like that's the biggest thing. And I know when I was trying to get sober, I at least had the fortune of getting sober in Los Angeles, which has so many culturally specific recovery resources for queer people. But it's not like that most places, So yeah, I think that's the biggest thing lacking is queer, culturally specific recovery resources.
Wow. let me say that from someone from the Bay Area, some of this is really difficult to hear, especially since here there are so much more of everything for everybody compared to what I'm hearing of other people's experiences. So I really do thank you for sharing and enlightening those of us who may not be aware of just how dire and how lacking and how others are being denied civil rights and justices. So thank you all for sharing that. Would anyone else care to talk about this or anything that has been said so far? Please raise your hand and Katie will let us know. I'll give it the old 10-second rule and then I'll ask another question. Okay. All right, then let's talk about the next question here. The question is, what are the greatest barriers you and those you care about face to mental health access? So the first question was about our unique needs, and now this one is about what are some of the barriers that we face when trying to access mental health, adequate mental health care. Katie, we have any takers?
Not yet. Okay, it looks like Destiny Patterson said pride, ego, and shame. Yeah.
Would she like to say more in her voice? Can we hear her?
Yeah, and feel free to unmute yourself, Destiny, if you'd like to.
Yes.
In the meantime, we also have responses: lack of providers,
Okay.
cost, providers, and trauma, cost, insurance that only contracts with certain providers, family not being accepting.
Yeah. That's difficulty. I mean, difficult. I do see that Chris raised his hand again, I believe.
Oh, I was thinking about all the ways I could start. There's been so many in the chat already, and I named a few pertaining to the subject. There's such a lack of LGBT qualified peer support, and really mainly the way inclusion is defined is different. Like somebody, I'll give you an example. There was a therapist that I worked with that claimed she was very inclusive. In fact, she would request LGBT clients to provide therapy to. And it came out later that, I mean, not that I'm saying anything bad about, Mormons, but she identified as a Mormon. And so her role, she felt, was to bring the LGBT folks in and kind of like not so much convert them, but show them that there was another way of life. So here it was that she put that she was inclusive. The majority of the LGBT clients went to go see her, but she was the first one to step up and say that transgender identity was a symptom of dissociative identity disorder. And so it ended up being that she wasn't inclusive, but the way she was defined as inclusive because she wanted to work with LGBT. That's the challenge, is how do you screen for that if somebody has, personal bias that they're not sharing that they have. And I think that that's really high up there on the #1 hurdle that I run into, especially in Arizona, is that challenge right there.
That's a huge barrier. Thank you for sharing that. Would anyone care to respond to what I believe Chris has just said?
People can also feel free to unmute themselves if they'd like to speak. Looks like Sage said that there's a lot of harm being done with LGBTQ inclusive therapists that have ulterior motives. Kim also said microaggressions from providers or outright judgmental attitudes from providers. Sean shared the lack of trauma and PTSD support and treatment for LGBTQ+.
Interesting. Well, thank you, Katie, for reading those, and I would really like to hear from some of those those people's voices. We would like to hear their voices and say more about something like the person who said something about ulterior motives. Can you say a little bit more about that?
Yeah, I was just kind of going off of what Chris said, where maybe it's really easy to market yourself as being LGBTQ inclusive. A lot of times it's just like clicking a box on psychology.com and not really having the training for it. I personally had a therapist who told me that she was comfortable working with transgender folks because she had a friend who had a child who was trans, and then after working with her found out that she had a lot of internalized transphobia, and that was a really damaging therapist relationship for me personally. But I can just see how easy it is to kind of market yourself as that and maybe go into it with the intention of fixing someone or just not really actually validating their experience.
Yeah, I never really thought about that. People just kind of jumping on the bandwagon, maybe just to get more clients and to get paid, and actually have no real insight into the what it's really like to belong to any one of these categories or classifications of humanity. You know, it's daunting. Please, someone else. We'd like to hear from you. This is about our voices, remember?
Well, I would jump in and just kind of like agree with what has been said. I think that there's a big disconnect, and also, hello, my name is Aaron. I use they, them pronouns. And I think that there's a big disconnect between what something like affirming or inclusive means in the provider world, and then what we actually need and what our experiences are with those providers. I work with LGBTQ plus youth, and we get all sorts of requests for information about what is available, what providers are going to be inclusive for, you know, anybody in like the different categories, you know, whether that's trans folks, non-binary folks, asexual folks, like anybody within the kind of spectrum. And it's really like there is no kind of centralized information about who's inclusive and what that actually means, as opposed to, like Sage was saying, like checking the box. And that's always been a huge barrier for like me personally, and then also for the youth that I work with.
And where do you work? Where are you from?
So Sage and I are actually both from the living room. We're in Clackamas County.
Okay. Great. Wow, we have 72 people in the room. Is that true? Let's hear from some of you. What's on your mind? What have you to say about these two questions? I heard a ding, someone else has joined, which is good.
Hi, everyone. My name is Kim. I am down here on the South Coast in Coos County of Oregon. Okay. I guess like our biggest thing down here, you know, if you need mental health support, the option of having a culturally sensitive provider isn't even really a thing. I mean, we have to fight for an appointment with any of the providers that we have because they're all we have. It's you know, personally, I've seen some that have been damaging after, you know, after having an appointment with them. If the question of, you know, identity or orientation is asked, you know, I've had appointments where I could just feel the whole tone of the, you know, quote unquote treatment shift, you know, after disclosing certain things. So I really think, you know, lack of providers, we're pretty much just whatever we have is what we have to, you know, if you need medication or if you need therapy, a lot of people just choose to go without because it can be too traumatizing to go through that. And especially, I work at one of the CCOs, the coordinated care organizations. So, you know, I've worked with a few individuals who, you know, are on trans, and just finding services was next to impossible. And it's really difficult and disheartening when somebody is finally, you know, moving forward on their journey or in their life, you know, as they want it to be, and just continue to be met with either ignorance or just that there is no, you know, there is no help that exists where we are.
Wow. Wow. The absence of choice is something that is really quite devastating to so many people on so many levels. To have to take what you can get is what the little note that I wrote. You have to take what you can get, and then you have to fight and wait probably long periods of time just to get that, and to show up, be open and honest about who you are, to be further traumatized by the treatment you receive after that is unacceptable. It's just totally unacceptable, at the least. Have others of you had similar experiences about, first of all, not being able to access services in a timely manner, and then to have to settle for what you get, so to speak, and be dissatisfied in the end, and choose to continue to suffer rather than to put yourself in positions where you are made to feel even less than. That's yes.
I would like to hop in on that. As a provider, like, and as a peer working, I just saw so many times when I was supporting trans individuals at the hospital that they would be misgendered in their charts, and misgendered by nurses, and misgendered and called the wrong name, even though they hadn't lived by that name sometimes in 20 plus years.
Yes.
And the trauma that that caused. And I saw in the chat, Jeff had said something about being in the emergency services too, and the same thing happening. But I think there's just such a lack of training and trauma-informed training at that for dealing with our community, that it's still like the 50s sometimes, depending on what comes out of people's mouths, you know. And it really, I identify as a gay man, and it really blew my brain open to see what my trans brothers and sisters have to go through. And it made me incredibly angry too. And so I think, which is good, right? Like, it's good to be in those situations that make you mad, because you can be a good advocate. But yeah, I find that that's the big thing, you know, is that there's just not any cultural training for providers, even though these are people who were in school and who went to liberal colleges, you know. So I think that's a lot of it.
Yeah, thank you for that. Yeah, it does kind of make you mad when you think it. It's making me angry now. I'm starting to sweat. I'm going to kick the bear, poke the bear, whatever they say. How about when trans people have encounters with first responders or law enforcement. Would anyone care to speak a little bit about that? So I can see myself going along and saying, okay, I'm denied this and I don't have that, and I'm dealing the best I can, and more or less accepting it for what it is because you can't do anything about it. And then having an encounter where you either are confronted by law enforcement or have a need for a first responder. Surely there must be a lot to be said about experiences of those nature. Someone, please.
So I don't identify as anyone in the LGBTQ community.
Okay.
I serve people in a day program that identify as LGBTQ, and I also have family members that identify in the LGBTQ world as well. There was just before the pandemic, I've been working from home since then, but even before the pandemic, I had an encounter where one of the participants in the day program that I worked at needed crisis evaluation. And this person identified, and so the emergency personnel came, the ambulance as well as the police department showed up for this particular situation.
Yes.
I was approached as a straight woman. I was approached with the utmost care and kindness and whatever as somebody who's trying to help serve my client who identifies.
Yes.
When I realized that my client identified as transgender, the tone completely changed. It was disrespect. It quite frankly, it made my stomach turn. And I stopped and I said, you know, I have the utmost respect for you, first responders. I said, but this is unacceptable behavior. This person eats and breathes the same way I do, and how are we going to best support this person who is in crisis, who is in need of crisis? You don't need to talk to this person any different than you're talking to me. So I guess what I'm trying to say is, you know, did I do the right thing for that client? Did I speak out in respect for what that person needs? Did I overstep boundaries for somebody who identifies? I'd like some feedback on that.
Absolutely. Thank you for sharing the situation, and I'm sure you will get a lot of feedback from others. I'm going to say just briefly, no, you are absolutely right in stepping in and saying the things that you said, not only for the person, but that shows a great deal about who you are as a person and what you recognize to be right and wrong. Thank you so much for doing that. And that needs to happen a lot more often. Let's have others respond to her. Who would like to share next? Who do you have, Katie? Tiffany has raised her hand.
Would you give me the charger, please? Thank you kindly.
Yeah, I mean, not a response exactly to that, but just to your question of, I guess my viewpoint is a little bit more around domestic violence survivors. So I guess in with that question, I see a lot of, and there's a lot of stats on it as well, as victims or our survivors getting arrested if they call the police because because of homophobia, because of being too lazy to ask questions, because of whatever, right? Because of our systems. Having like same-sex relationships where it's like they only look at the like a man woman being like who the survivor would be. So if it's two men, then maybe both are getting arrested, or whoever's being louder is getting arrested, that sort of thing. So and then also just, I'm also in Portland, Oregon too, as Sean was talking about. So we just have lack of treatment centers and resources that are really, you know, I like a lot of people that I sponsor are gay men, and it's constantly a struggle when they go to treatment, because they too are domestic violence survivors, and it's very triggering to have to sit in a traditional treatment center with a bunch of men who are talking about abusing their girls and stuff. So it's been really challenging, and being as big as we are in Portland, you would think we would have more resources. So that's all I had to share.
Well, thank you, Tiffany, for sharing that. Any responses? Anything in the chat box around this, Katie?
It looks like we have some questions.
Okay.
Let's see. What would and did the person you were supporting say about the incident and your response? That was to Tammy. David also just said, I work for my county health department. There would be response to the first responder agencies to educate and smash stigma.
I did respond to David in regards to the question, what did the person I was supporting say? The person said that the response from my person served was, we need more people like you. Thank you for supporting us. And, you know, to be quite truthful, I would do it again and again and again and again and again, because that's how strong I feel about everybody being treated equally, no matter what the situation is.
Great, good response, yeah. Because when it comes down to it, I am you and you are me, except for small nuances and or differences such as who we love. That's what it boils down to, and that's a really sad thing when we can't love who we want to love, be who we want to be, express ourselves as we would like to, and thus have a greater and more fulfilling life as a result of all of that. What else was there, Katie?
Another question, it looks like Andrew asked, I'm new to providing peer support and thus new to working with LGBTQ individuals as peer supporter. Any advice for me as I work at my new role?
Okay, read that again for me, please.
Sure. Yeah. I'm new to providing peer support and thus new to working with LGBTQ individuals as peer supporter. Any advice for me as I work in my new role?
Who would like to answer?
I'd like to answer that, if that's okay.
Please do.
I would say treat people the way you would want to be treated. If you want dignity, respect, and everything in between, give that back to the person you're serving. Because that ounce of care, kindness, and love is going to go far in the peer world. And it's going to go even farther in the LGBTQ world.
Nice. True. Anyone else want to respond to this?
I would say just to make space for talking about it. A lot of people want to talk about it, but they maybe don't know how to bring it up, or they're afraid. what someone might say back to them. So just making space for it, and you know, just being there when somebody does want to talk about it can be just more than you know, people would think that it means, to just be able to acknowledge it, and because a lot of people in their lives may not.
Right, so true. And I like what you said, just make space for it, just be with it, treat people the way that you would want to be treated, and do not be afraid. Eliminate that fear factor where you will maybe perhaps somehow be considered guilty by association, or because you are perhaps an ally. Don't let those things keep you from being and doing the right thing, which is accepting the person in front of you and behind you and to the left and to the right of you as people just like you are. Yes, as unique individuals. Someone else wanted to say something. Go.
I would offer that it's a chunk of it is being aware of others' worldview and what they bring into it. Even as I identify as a gay man, but none of us are a monolith. You know, and we all bring our lives into it, and just being aware of the worldview that those that we work with bring into the picture when they are meeting with us. It's not judgmental. It's accepting. It just is.
Thank you. And that was Doug, right? Yes. And Doug, where are you? What part of the state are you in?
I actually am right across the river from Portland in Vancouver, Washington, and I work for Cascade AIDS Project there. Although the home base is in Portland, I work in the Southwest Washington offices.
Okay, well, thank you for that. Yes, well, this has all been really very good so far. And in the interest of time, please, if you have more to say about anything that has been said so far, please do fill up that chat box, because this is all being recorded, and I will respond to all of this stuff and put it all into a report to be shared with all of you at a later date. So I'm going to move on to the next question, which is, that's the wrong way. So if you could create the perfect LGBTQI2S gender non-conforming plus mental health care system, what would that look like and sound like or feel like? Anyone care to respond? Someone? Surely.
All right, I'll say.
Go ahead.
And, so I'm Ben. I'm a sports specialist down in Grants Pass, Oregon, which is very rural. Not something, I don't have a lot of experience working with that community. I think that for me, what it would look like if there was a perfect system would be all inclusiveness, and I hope that I'm not being ignorant, because it's not something that I deal with on a regular basis. And so I think it's just be inclusive, and just like what's been said earlier, is just keeping everybody on an equal playing field. The unity of recovery in general, that's what the beauty of it is. That's what recovery is it's all inclusive. It doesn't matter where you come from, what you've done, doesn't matter any of that before. It's just what you're here now, so how can I help? And that's the approach that I try to take with anybody. You know, I know that some people have problems with if you have past sex crimes or stuff like that, right? But to me, I don't care about any of that. You treat me with respect, I'm going to treat you with respect. You tell me what you want and tell me how I can help, and let's do it, you know? And I think for me, a perfect system would just be to just include everybody. Everybody's included, everybody's welcome, and how are we going to help have a better life for not just myself as a recovering addict, but any recovering addict that wants something better? How can we help? And that's, to me, that's what a good system looks like.
Yeah, thank you, Benjamin, for sharing that. Yeah, go ahead.
Destiny Patterson, Denver, Colorado. I'm a peer bridger at Rocky Mountain Human Services. Just to piggyback on what he was saying, inclusive and just all around unconditional love with ultimate support, but I feel like it would be absolutely imperative if the staff was not knowledgeable about the people they're working with. It is, pardon my French, asinine to not want to be knowledgeable about the community that you're working with. That kind of piggybacks about what we were talking about. Maybe it's an ego thing, or, you know, just wanting more clients, but that's not going to better the community. I identify as a bi-Black woman, and I don't tell people I'm bisexual all the time just because of the fact that there is a stigma, and I don't feel like hearing that shit because I'm already a Black woman. So I already have enough to deal with than to add on, oh, you're bisexual too. So, you know, just having people be knowledgeable and willing to learn more before they have their people coming to them saying, oh, I need to teach you this. It's not always up to us as a Black woman, as a person of this community. It is not my responsibility to always educate people. So I think that would tie along with being perfect, you know, in that perfect facility, if you will. Thank you.
Yes, absolutely. Destiny, thank you so much for your share.
You're very welcome.
Yes, to further have to justify who we are because of where we might come from, what we might look like, what our beliefs are, does not help the situation at all. We should be accepted as we are for the unique individuals that we are. Would anyone else care to respond? Do you have anything for me, Katie, or someone else would like to speak? Please do.
I have something. I feel like I'm talking a lot, and for that I apologize.
Please don't apologize, because this is about our voices. So lift your voice. It's fine.
Thank you. And I realized before the last time I talked that I didn't say who I was and where I was from. My name is Tammy, and I work in a nonprofit agency in a day program system with early psychosis people. And I'm from Chicopee, Massachusetts.
Oh, okay.
So I think that for me, what it would look like, sound like, and feel like is I would get away from treating people as a number, and treating people as humans, as people that we deserve to be treated as. I look at a bunch of these agencies and a bunch of things that my people that I serve say to me, and they just often say, you know, we're treated as a number. We're not treated as a human. We're not treated as somebody who breathes in whatever the same air. And I would create that space to be safe. And I would create it to be as people just in general. It doesn't necessarily have to be the LGBTQ community. I think that I want to open it out to everybody, you know, just being a safe space, and allowed to be who you are meant to be and who you are. So I would put a lot of that into a system or a healthcare facility or whatever we would like it to be, where people can just be who they're meant to be.
Yes. Wow, thank you for sharing that. Tammy, it was. Thank you so much. Yes. Well, I am going to move on now to our last question. Please, like I said, if you have anything more to say about anything that we talked about, use the chat box and we can address that later. Here's the last question. So, what can we as people with lived experience do to change the system for the better? What can we as people with lived experience do to change the system for the better? I would think that one thing we can do is advocate for ourselves, maybe try to change what's going on in our state's legislatures and that sort of thing, right? Your Congress people. These are just some things off the top of my head. What are some other things that we can do to change the system for the better? Anything in our chat box, Katie?
Sage said, peer support, help folks navigate the systems we've already been navigating. Definitely agree with that. Jimmy also said, intentionally show up in community. If either of you want to elaborate, you're more than welcome to. Yeah.
Please do.
I will. This is Jimmy. Since moving to Portland from Seattle and being in recovery and smart recovery and peer support, oh my God, do I miss my LGBTQ plus peer support option, you know? Peer support is great and I love it, but it's just, there's so many different dynamics in the LGBTQ experience that are hard to relate to unless you understand it through lived experience. And I would give anything to see us have a bigger intentional peer support effort for the Portland community.
All right, Jimmy. Yes, thank you. Peer support is really very important. It's sometimes the only lifeline that someone may have to sustaining mental health. To sustain mental health. Anyone else? I think it would be a great thing if there were a greater presence of professionals who identify as LGBTQI2, as gender non-conforming everywhere, but people are, like as has been expressed, afraid of probably maybe losing their jobs, losing their housing, losing their status in the community. They are so afraid of what they might lose that they somehow dismiss the potential for the good that may come out of it and the gain and the positive impact for so many people who are left to wander and wonder and suffer. Would anyone else care to please share?
I'll share a little bit. For me, it's staying humble, you know, and remembering where I came from, not getting caught up in the clinician norms or a bunch of credentialing. Like my lived experience is what's made this opportunity available to me, and so principles before personalities, and that I'm here to help anyone who that our paths cross, and to break down the differences and stay connected or build bridges to the similarities.
Okay.
Thanks for this forum.
Yes, thank you. You're David. And you're where are you located, David, did you say?
Bend, Oregon.
Okay, great. All right.
Hi, Kozi. This is Julia. I'd like to say a brief something. Nice to see you.
Yes, hi, Julia. You remember me, right?
Yeah, absolutely.
Good to hear and see you.
You too. Hey, I just want to say, from being on this call today, it's, I'm from Northern California, but I moved to Oregon rural community, and I'm living in Baja. So just getting to know Oregon and the people on the call today, it's been really eye-opening for me. And to see the comparison between the Bay Area resources that are available and the support that's available compared to Oregon and the rural areas and what is not available. And to just, for me, I'm gonna be a licensed minister soon. And for me, it's really important this time with you today, all of you today, and I am part of this community, to take in just the diversity, not us as individualized expressions of the one, but the diversity of resources that are available and aren't available, and the diversity of people's belief systems and all that. It seems like a challenging time depending on where we are geographically and just being on the planet right now and what we're going through. But just recognizing the importance of peer support and how important it is for us to be able to connect with one another and support one another in a setting like this, for instance, is just a beautiful example of how important that support from our peers is. And I just want to thank you, Kozi, for modeling for me, when you asked, what are your pronouns, right?
Yes.
And apologizing because you may have used the wrong pronoun. I'm just barely scratching the surface of learning about that, and how important it is. And, the more I learn and the more out there people are feeling, safe enough to be, the more I can become aware within myself of being cognizant of how I address a person as they, them, whatever. So I really appreciate this. Has been very helpful for me today, and thank you so much.
You're very welcome, Julia, and thanks for your share. And if you're ever really not sure, it's perfectly okay and empowering just to ask the person, how would you like to be addressed, and how can I honor you for you being you? Thank you so much, Julia. That's awesome. Very awesome. I'd be happy to see you again one of these days. It's been a couple of years.
Absolutely.
Yeah, absolutely. Would anyone else care to respond to any of these 4 questions? What unique mental health needs do you have as an LGBTQ community member that the current system is unable to address? Question number 1. Question number 2. What are the greatest barriers you and those you care about face to mental health care access? Question number 3. If you could create the perfect LGBTQ plus mental health care system, what would it look like? What would it sound like, and what would it feel like? And lastly, what can we as people with lived experience do to change the system for the better? I am going to ask one more question, and that's to everyone in the room. I see we have 100 people in the room. You should all give yourselves kudos. I see Dorothy Simic has raised their hand. Please, Dorothy.
Hi, everyone. I'm new to this. I've been doing volunteer work for 20 years in the community. And one of the things that has been a barrier for people to get help is access to care. It is important to provide a client with bus fare or a mode of transportation if they're not capable of taking the bus to get care. And I was homeless for 3 months in my car, and I lived in transitional housing for over 2 years. And I could have been on a better path than I am now, because the conundrum was going to eat food that day or take the bus to get care. You have to make sure the client has the food, the housing, stable, and the access to get the transportation for the care, because there's been many times in my life and also other community members' lives where that $5 to get the bus to work, to the clinic or what have you, cost them not having lunch that day. So we need to make sure clients have more than just food stamps, more than just a bus ticket, and actually secure them in a dwelling where they can have refrigerated food and a place to use the restroom. And I think that's the synopsis with all of it. Ask their pronouns before you give them a bagel with cream cheese at the coffee shop. You buy them coffee with the bus pass that you give them. And that could be the solution, the Band-Aid on all of this. There it is.
Nice, so nicely put. Thank you so much.
By the way, I'm they, them, and I live in Portland, Oregon, and I'm part of the House Order of Benevolent Bliss Sisters Perpetual Indulgence there.
Oh, wonderful. Did I mispronounce your last name? Is it Semachek?
Just don't call me late for dinner.
Won't do it, I promise. Okay, I saw that 2 other people had raised their hands. Let's see if we can't hear from them.
Titan here from Grants Pass, Oregon.
Okay.
So I just recently started working with an individual and I feel like my process has to be different in helping them get into a residential facility. And my normal process, I have 10 different residential facilities. I get the ROIs, I go forward with it, Well, 9 of the 10 will not accept him because of his beliefs. Is there a way kind of around that? Is there something I can work? Do you guys know of something? Like, I'm trying to help this individual and I don't want to sit there and tell them, hey, don't believe what you believe just so that we can get you the help and get you started. You know, I want them to live their life, but I just don't know what to do in order to help them to at least start the process so they can move forward.
Wow, you know what? I'm so glad you asked that question. I wish we had more time. I would like to encourage you to please, if you're willing, to put your contact information in the chat box, and for those who may have responses to your question, can directly communicate with you, because I would like to hear what others have to say about that, but it appears as though we have like 2 or 3 minutes left. Thank you so much. And please, please put that information in there so that we can get back to you with some responses, because that was a really good question. We had another hand raised. Is that person still wanting to speak? Last caller or last speaker. If not, please, like I encourage everyone else to do, put your questions in that chat box. All of it will eventually end up with me. I'll compile it into a report or a document and get it back to all of you who are in the group today. Thank you so much for being in the group today. I would like to ask one more question so that I can know how better to do my next presentation. What questions might I have asked today that might have been a good question to ask? You can also put the responses to that in the chat box. Yes, so hello everybody. Hey, I'm hoping that this workshop was beneficial, informative, anything good and wholesome to those of you who were listening and those of you who were watching. Thank you so much for your support today. We had 100 people. I was really quite worried about how this was going to go, if it was going to go. And now I can really take a giant sigh of relief and feel good about how well it actually did go, despite our very few technical difficulties, which, you know, is part of Zoom occupational hazard. So peace and blessings, everyone. Take care of yourselves, love one another. Keep an open heart and an open mind, and remember that the next person and they're human just like you are. Search to find the good in them, and then surely you'll go far. For to accept a stranger and not look down on them will help one understand oneself and what goes on within. So just take a look around you at all of the things you never see, and realize that you'll never know what lies beyond the door without the key, and you hold the key. Peace and blessings, everyone. Thank you, Katie, so much. I'll talk to you later. Love you. And I'm out.